Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello, thank you for joining us for today's webinar, where we will hear from hospice experts Zaundra, Ellis, and Matt Abbott on things to keep your staff engaged, productive, and passionate about providing the best hospice care. My name is Molly Casey, and I'm the Vice President of Marketing for Axxess. Before we get started, let me tell you a little bit about Axxess. We are a leading home healthcare technology company offering a complete suite of easy-to-use, innovative software solutions, empowering hospice, home health, and home care providers to grow their business while making lives better. Today, we will hear from Matt Abbott, a clinical project manager for Axxess. Matt is a member of the hospice product development team, where he is leveraging years of industry experience to help create Axxess's hospice software. Prior to joining Axxess in June of 2018, Matt served as a hospice nurse in a wide variety of roles, from inpatient unit and field nurse to director of education and director of clinical operations at hospice agencies across the country. He is passionate about hospice care, having served in the hospice industry his entire nursing career. Also joining us is Zaundra Ellis. Zaundra is the hospice product manager for Axxess, where she is responsible for all facets of the development of Axxess's hospice software solution. She leverages her many years of hospice industry experience and expertise to lead the team that is creating software specifically for hospice professionals, whether clinical or administrative, that is easy to use and compliant with CMS hospice regulations. Before we get started, just a couple of housekeeping items. Everyone's phones are muted. However, you may submit questions throughout the webinar. If time permits, Matt and Zaundra will answer as many questions at the end of the webinar. If we don't have time to answer your question, we will follow up with you at a later time. We will also share the slides and a recording of the webinar at the conclusion. Thanks so much. Welcome, Zaundra and Matt.
Thank you so much, Molly, for the introduction. Zaundra and I are really excited to talk to you guys today. I think every one of us has been touched by retention problems and turnover problems in hospice agencies for a variety of reasons. So we'll spend some time talking a little bit about kind of trending in our industry and some of the data points that you can have at your disposal and kind of where the industry as a whole is going. But then most importantly, we're going to be talking a little bit about some strategies to help you retain the staff that you're spending time and resources to train up so that you can provide that crucial care that we're providing for patients at the end of life. So the objectives for our webinar time together today are that you should be able to discuss staff satisfaction and retention challenges that face hospice agencies today. We will examine different teaching and learning strategies for your adult learners. So we know that the onboarding process as well as the education process of your new staff is very important to retaining those people that you're hiring. And finally, we'll be identifying strategies that you can use to create employee engagement with the staff that you have on board.
So one of the reasons most of us on the call went into healthcare, specifically home care and hospice, is because we have a passion for the aging population. The good news is that that aging population is continuing to grow. As you guys can see on the slide, we have 10,000 Americans that are becoming Medicare eligible daily. The numbers that you see here should provide you with a good feeling about your job security. Our aging population is going to continue to boom through 2060, and you'll see here that that senior population in the U.S. will double in 2060. And it's important to remember that 2060 number, that is building on the growth every year prior to. So when we go back and look at it historically, just for a frame of reference, in 1990, 12.6% of the U.S. population was made up of folks that are 65 or older. we actually saw a decrease in 2000, a little decrease to 12.4%. When we get to 2010, it jumps to 13%, and projected for 2030 is 20%. So that continues to grow over time. It is definitely going to require a lot of problem solving and a lot of effort to make sure that we have the folks needed to take care of our aging population.
Yeah, I think the most alarming thing here is, the projection of how many hospice specialists in particular are going to be needed to take care of these Medicare beneficiaries. So they're looking from 10,000 all the way to 24,000, but you can see there's an expected shortage here, as little as just 2,000 people. I mean, think about finding 2,000 workers that we have to find, up to 19,000 that are going to be expected. And so there's just very evident a shortage of specialists that are going to be available to take care of those. So things that are working against us, certainly changes in the workforce. We know that nurses in particular are aging. We don't have as many millennials coming into the nursing profession, and those that are working more in that inpatient hospital-based setting. They want a little bit more structure there, is some of the complaints that we hear. So changes in the workforce are certainly there. That nationwide shortage that we've been talking about since 2010, of staff that's available is only going to continue. And then there is a limited amount of things that we can do about affecting those two things. But the last 2 points here, increased staff turnover and decreased staff engagement, are something that that we at hospice agencies today can really affect and make sure that we keep those good employees that we have hired in the hospice industry and continuing to provide care for our patients.
That's right. So really taking ownership and making your hospice the preferred provider in your community, whether that's a large community or a metropolitan area, should always be the goal. So as we look at the number of registered nurses today, only 85% of those are practicing. So that means that we've got 15% that are working in other fields. It also means that 85% that we're sharing with hospitals, clinics, schools, the government. So there are a lot of nurses that are spread out in many industries. So it is definitely a small group of nurses for a great need across the United States. So one thing that was really struck me when we were preparing this is 53% of registered nurses are over 50. So those folks are closer to Medicare beneficiary age than they are to college graduation. And, not only are they going to be leaving the workforce at some point in time, we all know that being a registered nurse is labor intensive. So it's hard on your body.
Yes, it is. I can speak from experience.
So, a lot of times those nurses don't last until they're 65. But not only leaving the workforce, we're losing that knowledge and experience that they take with them. And those are things that they have earned and learned over time, and valuable information that needs to be shared with our younger nurses that are coming out. So hospice practitioners, there are 13.35 for every 100,000 adults 65 or older. Now,
the next time people are complaining about caseload, right? You talk about 1,000 patients on your caseload. It's just insane.
It's not a problem. We're not worried about 1 to 12,
right.
or 1 to 50
right.
Nursing ratio. We're worried about having 1,000 nurses, so 1,000 patients for every nurse. So it really is, it affects us as an industry, but it also affects our public health and our population. So we need to look at it not through the keyhole of hospice, but we really need to consider it from the perspective of the U.S. Healthcare and economy.
Absolutely. So how does the world of healthcare providers kind of fit into the need over the next 10 years? This study from the U.S. Department of Labor and Statistics was done to take a look at new jobs that are needed and the replacements that will be needed for those jobs in order to meet the demand of the healthcare industry across a variety of disciplines in the healthcare field. And you take a look at the top 3 in this category, or even the top 4. You're looking at nurses, aides, nursing assistants, and home health aides, all in the top 5 of where we're going to need to have replacements for people leaving the workforce. And so I think this is just hugely shocking for our industry of hospice care. You know, how many of you have RNs, LVNs, and home health aides on staff currently, right? So looking at these projected numbers from the Department of Labor and Bureau of Statistics really just kind of drives home what we already know that we need to have this staff on board.
That's right, and I think really putting numbers to this is important, because we talk about, you know, the staff shortage, we talk about turnover, but a lot of times we don't put numbers to it, we don't budget, we don't plan for it. So as you see here, home-based care provider turnover rate is 82%. The good news is that you see in hospice, that's much lower. Mm-hmm. So there tends to be a little more job satisfaction with the hospice care providers because of the relationship they have with their patients, and also the close relationship they have with their interdisciplinary team, because they're really working together as a team. They talk every day, mm-hmm. a lot. Yep. So it really lends itself to some job satisfaction there. But as we look at the things that we've heard from our staff, and everybody's heard them, mm-hmm. I'm sure, things can seem like they're out of control. But when you sit down and you list the things that you're hearing from your team as to why they're leaving, why they're unhappy, maybe they're disengaged, when you start asking those questions and being honest about the answers you're getting, when you look at these things, a lot of these things are in your control. It takes some creativity, it takes teamwork, and commitment. But these are all things that you can work with your team to make sure that you mitigate these things that affect every healthcare worker, specifically hospice workers today. And I know Matt has been the person that has had these issues, and he's also been the person that has heard these issues from his colleagues.
Yep, absolutely. So I think, you know, again, my workload is equivalent to 2 full-time jobs, right? I'm documenting all night. This one at the bottom here, I love my patients, but after 6 months of staying up until 10 p.m. every night, I finally had to leave a job I love. And so while our nursing and aid statistics are a lot lower than in-home care providers in general, I mean, you're looking at 1 in 5 of your nurses is going to turn over. Based on the 2018 statistics, 1 in 4 of your hospice aides is going to turn over. And again, as we move to the next slide, you can see the cost of turnover for a nurse ranges anywhere between $37,700 and $58,400. And I don't know about any of you, but I don't think any of you has just, you know, an extra 40 grand sitting around that you can utilize, you know, on that staff turnover. And so taking time to listen to what we're hearing from the industry is so important. And again, we can see this affects not only the staff that is still there when they see nurses kind of going through that revolving door, but it also affects the volume of resources, the dollars that you have to spend on your patients.
It does. And I would say, you know, a lot of times we see, you know, clinicians leave and they'll go to a different hospice, and sometimes they go in packs. Mm-hmm. So one person goes and then somebody else goes with them, and the grass is greener, so other people go. And, you know, along with the financial loss that you have, you know, that knowledge loss of compliance, policies and procedures, you know, that often leaves with those nurses. Right. And you have to start over again, and that is extraordinarily expensive.
Yep. So let's take a look at what is causing all this turnover in the first place. And so, again, I think this is probably going to be familiar to a lot of us. There are things we've said or things we've heard. Maybe just today we've heard these things. But again, my workload has increased. So when you have an increase in turnover, that means you're still having to take care of the patients with less resources. And so the documentation requirement is going to increase. You might have a surge in your caseload. I can tell you a personal story. I was working at an agency And there was some nurse dissatisfaction, and I had just started with this particular agency, and a full half of the nursing staff walked out the same day. And so the two of us that were left picked up the 40 patients between the two of us. And so, you know, our caseload really surged from going to something that was manageable with, you know, 10 to 12 to 15 patients up to 22, 23, 25 patients. And so that surge in the workload is obviously going to put a drag on the staff that remains. And then, of course, that added to my drive time as well. So for those of you who are in Texas, I was driving, you know, from far east Texas all the way through to Fort Worth. And so I was spending, you know, 2 hours sometimes between patients. And that certainly is a drag on staff satisfaction. The use of administrative staff to cover visits. So those of you who are directors of nursing, clinical managers on the line, right? How many times does your administrator walk into your office and say, can you pretty please go out and do this admission? Or can you pretty please take a caseload of 4 or 5 or 6 patients? And now you're taking your administrative work home with you. You know, you're sitting behind your laptop doing the work that you would otherwise have done during your workday. And that leads to burnout. You know, there's only so long that we can work at that pace as a manager. And then, of course, there's the personal reasons that go along with that as well. So I'm just getting exhausted talking about these changes, these additions. So fatigue is certainly one of those things. And, you know, we saw that in our quotes. You know, there's only so long you can stay up till 10 p.m. Every single person that I've worked with in hospice is very passionate about patient care. But sometimes we just drive ourselves all the way to the end of our rope to be able to do that. Again, drive time leads to that, and of course that work-life balance. If you're sitting behind your computer at home, right, your kids are going to start asking, well, when are you going to, you know, come out from behind the screen? So
yeah, and I think, Matt, I mean, you know, as an executive, you know, an administrator, to me, those things are heartbreaking because now we're asking, you know, our clinicians to pick between their family and their patients, and we know that they love them both, but that is never. That should never be a choice. You know, work-life balance is extraordinarily important. And, you know, as leaders in your organization, no matter what your role, you are a leader.
Yep.
You need to see yourself as a leader, and you need to be thinking about how you can make this better, because working now to make it better is going to improve things in the long run.
Absolutely. Absolutely.
So disengaged staff is one of my favorite things. You can spot them from 100 miles off, right? So they're on their cell phones when you're having a staff meeting, if they show up, right?
Yep.
What are you going to do? Stop the staff meeting and go get them at their house? Come get me.
Yep.
You know, true story. I had a problem with a disengaged employee one time, and unfortunately, it ended up in her termination. She made some grave errors.
Yeah.
No patients were harmed, I have to say, in this demonstration, but she had some errors and we had to let her go. And she looked at me and said, I was looking for a job when I found this one. If that's not a disengaged employee, I don't know what is. And that was startling for me. And it really, I laugh about it sometimes, but it really was my first, oh, this is a problem. So disengaged employees, not engaged at all, 49.5%.
Yeah.
That does not lend well to quality care, teamwork, compliance. And if you look at the cost of disengaged employees, that's with a B, you guys, $292 to $355 billion per year. So how do you come up with that number? Well, you have to replace them. They make errors. Right? There's just a lot of things that go into that, including they're goofing off, and not because they're just goof offs, but they don't care. They're completely fried.
Yep.
They're not committed to your mission and vision and your culture.
Yep.
And it's better use of their time to play on their phones or pick up their dry cleaning or go take a nap instead of being productive. And that is not a negative, judgy kind of statement. That is a description of an issue that we need to address.
Yep. And you think about, how that impacts the work of your agency, and you stop and you think about, imagine sending that person to a patient's home, where they're, a family member is stressed or a patient is explaining a symptom that's going on. And if your employee is disengaged in the patient's home, that can lead to negative outcomes that are just going to have just ramifications throughout that. The other statistic here is if your employees are engaged, they're more likely to stay. So we've talked already about the cost of turnover, what that does to your staff, what that does to your bottom line. But those employees that you can get engaged in the process, get engaged in your culture and the mission and vision and believing the things that your organization stands for, they are 87% more likely to stay with your organization, which is just going to lead to better outcomes for your patients as well.
Yeah, I'm sorry, Matt. That is huge. And I would add to that, just a little hint, a little nugget here. To really check yourself, kind of the starting of the checklist of things that you can do to make it better. Are you engaged?
Right.
That's a great point. Are you checking yourself every day? Am I engaged? Even if you don't feel like it, can you fake it till you can make it?
Absolutely.
And if you can't, maybe it's a day to take a PTO day. It's okay to take care of yourself.
Absolutely. I think I'm really glad you said that. I think, especially in healthcare, we see people that have 200 and 300 and 500 hours of PTO just sitting in their PTO bank. And so it is okay to take a mental health day to say, you know what, I'm exhausted, I'm mentally fried, I need to take some time to just get away. So we've put some questions here that you can kind of ask yourself. So you can start to investigate and see. Some employee disengagement is really obvious, and we've talked about some examples, but these are some things that you can kind of ask yourself when you're, in your next IDG meeting or you're in your next staff meeting where you're engaging with your employees. Are they negative? Are they falling behind in their work? Do they complain to you about constantly being stressed out? Can you see apathy in their work? I think that's something that you can identify as well, right? Are there patients calling after hours more frequently than they were before? Can you sense that disengagement?
And I would add, when you're talking about patient care, are there patients calling more often?
Mm-hmm.
Are they disengaged during IDG?
Right.
I love an IDG meeting where good hospice nurses are trying to out hospice nurse each other, right? That's where we get the very best outcomes for our patients that we care for. And sometimes if you see somebody who usually, has the best ideas and is willing to get in there and share those and train and educate and be involved, that maybe they're not feeling it and they're not participating like they would, that's a good sign that they're not engaged. And these are all things that you can use as checklists for yourself.
Yeah.
Again,
yeah.
What am I doing today?
Yep, for sure. That last one's kind of obvious. Are they leaving your company? But I think it is important to track those statistics. How many people are leaving your company? What is your turnover rate at your company? And how are you doing? It's a great metric to keep tabs on. So we painted a pretty gloomy picture so far, so we're going to sort of switch gears here for you and talk about really some strategies that you can start employing today to retain and engage your staff to prevent that staff turnover, to prevent you from having disengaged employees, and to improve your standing with your employees, perhaps, or your agency's standing in the market that you're serving, and most importantly, of course, improving those patient outcomes. So we'll talk about each of these strategies in detail, but again, retaining and engaging employees starts with bringing the right people in the door in the first place. So I know Zaundra is going to talk about some strategies with that. She has lots of experience building teams, so she'll share some of her best tips with you about how to attract the right people in the first place. Getting those people successfully onboarded. So an employee's orientation and their first 90 days to 6 months with your organization is going to be the difference between whether or not they stay beyond that 6-month mark. And so we'll talk about some strategies, how to get new staff on board and then provide an effective orientation for them. An employee mentorship program engages not only your new employees, but that also gives the employees that you have on staff already that have some longevity, it gives them that extra boost, that extra confidence to say, my boss trusts me to train the new nurse or the new social worker or the new aide to be a member of the team and to see what it's like to be an excellent hospice nurse. They think I do a great job, so I'm going to get to teach somebody else how to do this. Empowering your staff, certainly choosing the right electronic health record partner. Your EMR vendor is so important. We hear so many complaints about documentation, and so making sure you have the right technology partner is important. And finally, providing support and recognition for your staff. Again, a great way to get your employees engaged.
Yeah, Matt, I mean, these are things that I am very passionate about. I love building a team. You know, it's hard work. But it certainly can be done. And as we start to go through this, I want you guys to know that these are really practical tools. So these aren't, you know, pie in the sky things that, oh my gosh, I'm never going to be able to do that. These are things that you can do starting today to secure your staff. So the first one, we have our job descriptions. We know what we need people to do when we hire them. That's the easy part. But really, finding the person that fits into your organization. Now, we're not a club, right? So if you want to have different thoughts, you want to have diversity in thought, you know, you want to have the right combination of people. Don't hire a warm body that has a license.
Yep.
You know, hire someone who is in alignment with your mission and vision and your culture. And, you know, obviously we want them to have the right skills, but, you know, a lot of times we hire someone because, oh my gosh, my on-call nurse quit. This on-call nurse, she applied, she looks great. She's changed her job 5 times in the last year, but I think we should take a chance on her. This is the one, she's going to be happy here. That would send up a red flag for me. You know, what's going on with this person? Let's talk to them and really dig into, find out if we're going to be able to keep them engaged and happy in our organization. So understand whether they're the right fit for your business and what's going on. I think it's really important to think about the success of your agency with every hire. So one hire at a time. My favorite story is 100 years ago when I started in hospice. My first day, I got a phone and a copy of the regulations and keys to the office, and good luck. We had 5 patients. That was great. But as we grew, I had the opportunity to build a team, and that was going well. And I had a nurse that walked in my office. She was a hospice QA professional, and she was very well regarded in the community. She was certified in hospice and palliative nursing. I hired her. She was really tough.
Yeah.
She didn't take any hostages, man. She QA, right? But once I hired her, all the other nurses, all the other hospice professionals, they were beating down the door to go to work at the agency I was at. It took that one good hire, that one right person, and then I knew exactly what I wanted. And we were able to hire hospice professionals until we had a pool of applicants. Our turnover was 6% that year, and that was largely driven by a young lady who left to go to college.
Yeah.
So hiring the right people, even if it's not the right time, if you can fit it into your budget, if that's the right person, please don't go fire somebody just because you found the right person. But, you know, if you know, hire them, figure out a way to make it work, and it will set you steps ahead of where you were yesterday.
Yeah.
And group interview, my favorite.
Yep. I love that. I love that point as well. The group interview, getting more than one opinion on a particular person. And the other strategy that I've seen and employed is do a ride along. You know, see what that person is like in the field. So for a field staff member, let them go out with one of your experienced staff members. Sign your HIPAA waiver, sign all of the consent forms that you need to make sure that you're covered from that perspective. But getting them out in the field to see, do they talk to other people in the nursing home, or how do they engage with one of your current employees, and get your employees buy-in on that person as well. I think it is so valuable in making your current employee feel validated and feel important, but also it gives you even more data to make the right decision and make the right hire.
Absolutely, Matt. And I think it's important to remember that that's not a sales call. You're not selling your agency on that applicant.
Right.
You're interviewing that applicant. So those visits should not be to your sweetest, most pleasant, most beloved patients that everybody wants to go see. We all
Right.
have them. There should be some challenges along the way. So it's important to remember that is not a sales call. It is a job interview. So make sure that you send them with someone who is savvy enough to be able to pull that off for you.
Yeah, for sure, for sure. So you have successfully, congratulations, hired the right employee. At this point now, it's time to get them on board with your agency. And so this is a mnemonic device that we have included in our presentation to kind of give you a takeaway, something to kind of keep in mind. And so we have built this slide really as a stair-step approach because you have to build kind of that solid foundation and start with step one, start with the basics, and then continue to add additional pieces on as that employee spends more and more time at your agency. So certainly we know that regulations are increasing in our industry, and compliance to making sure that you can continue to practice and you don't get shut down at your next survey. So teaching about compliance, the basic legal and policy related items that you're at your agency, hand hygiene, infection control, patient safety, patient rights, all of those things that you have to go through for your own compliance with your onboarding process, but also to make sure that your staff is really grounded in the compliance of practicing hospice in the best way is there. The next is to help them develop connection, and this is not something to be taken lightly. Certainly, interpersonal relationships are what we all kind of crave as human beings, and so it's really important to kind of bring those new people along, introduce them to people in the office, maybe take a tour of the office so that everyone on board can get a chance to meet the new employee and greet them. And that is something certainly I've seen in my past, just so they get a chance to know a few names in the office. It's very kind of intimidating to go in on your first day at a new job and not really know anybody except for the person who's your boss who hired you. So helping them establish those relationships and making those introductions for them is hugely important as part of your onboarding.
And I would add, that connection is so important because hospice professionals are very in tune to those connections. Mm-hmm. That's why they do what they do, because they deeply care about people. So it's important to deeply care about them. So in addition to what Matt said, let's introduce them, let's welcome them, let's take them to lunch.
Yeah.
You can go to McDonald's,
yep.
right? And maybe take a couple of people with you that they are not going to be working with every day, but establish that link early on so that they know that they can call somebody by name. And more importantly, those first folks that you introduce them to, make sure that those folks know that it's their responsibility to come back and check with your new hire.
Yep.
It's not just, hey, how's it going?
Right.
I did my job. I said hi to you. I'm going to go on my way.
Right.
I'll see you next week. But really check back with them and share that that information about how to get in touch with them.
Mm-hmm.
Here's my number.
Yep.
It's easier if you text me. Here's my email address. Oh my gosh, like I've been here for this long. I live here. Allow them the time that it takes to really develop that relationship and connection. So culture is something that is really an amazing thing in an organization. And when you've seen it, when you've experienced it, you know that there's no substitute for a good culture. You can hire the right people, you can do all the right things, but if your culture is not in line with your mission and vision, then you're going to be in trouble from day one. So it's really important to talk culture on the first day. Don't be afraid to bring up that conversation. While it's not something that they can see, it's something that everyone can feel, right? And so hopefully they felt that when they came in to interview and meet with the group interview, and maybe on that ride along, whatever your culture is, that's something that should be infused from day one. And so that really helps them understand when they can feel that culture, they're exposed to that culture, it's explained to them, then they know, okay, well, it makes sense how I felt when I came in, but they also know what to expect outside of the policies and procedures, you know, and how things work. So it really plays a lot into building the trust with your new employee. People do better when they know what to expect. So, and clarification. I always say inspect what you expect. So clarification is go back and check for understanding. Don't wait until the end. It is the last step. You do want to do a big grand clarification at the end, but as you go along, make sure that you're checking for understanding. Give people space and time to ask questions, and always give time for people to think about what you're presenting to them. Right? And even tomorrow, ask does anybody have any questions about what we talked about yesterday? We talked about how important it is to wash your hands between, you know, when you're finishing a patient, when you go to a patient's home, wash your hands. Does anybody have any questions about that? Don't just say, hey, do you guys have any questions about what we talked about yesterday? I'm not going to get any, everybody's going to say no or shake their head. I'm not even going to get a response, right? But if I say, let's talk about hand washing. Do you guys have any questions about that? We talked about A, B, and C. Anybody think about that or have any input into that, how we can make that better? So make sure that it's an engaging kind of clarification. Don't just say, did you get it?
Yep, absolutely. Kind of why are we doing this, and what does that mean? How do we actually do that here, right? And then make sure that they've got that understanding. So effective orientation, again, you can teach all of those things, those 4 Cs of onboarding that we've talked about, but making sure that you have that effective orientation is going to be the difference between, again, people staying and people getting that comprehension and getting that clarification that we've talked about. So structure is something that is so, so important. It is positively correlated with adaptation of what it is that you're teaching, as well as satisfaction. So in one of my previous roles, we had, I was in charge of orientation for my organization, and we had some didactic training that we would go in, we would teach them, we'd use PowerPoint presentations, we would do hands-on activities, we would do lots of different things with them, and then we would send them out in the field with a mentor, and the very first question, and the most frequent question I would always get from new people coming on board was, when am I going to get my orientation schedule, right? And so it was my responsibility to make sure that those schedules were coordinated and prepared for our new employees before they started. Again, we crave that structure. We want to know what's coming up next and what's after that, and how is that going to work. So having a structured orientation is very important. Even if it's a loose outline, knowing who is responsible for what parts of an employee's orientation, who goes first, second, and last, who's going to lunch with the new employees on the first day, who's going to be the mentor for that employee, and making sure that that is coordinated not only with for your new employees, but also that your current staff is aware of that, is going to help that be much more effective, so you're not catching somebody off guard when maybe they have another important task that they have on their schedule for that day.
So an easy way, one way that's easy to kind of drove it home for me, and I don't remember where I learned this, but, you know, someone once said to me, or I read somewhere, you know, we often throw going away parties, right? Somebody's leaving, let's have a party. Oh, I remember, it was I did an internship, so that's where I learned this. Going away parties were not allowed. We threw welcome to the team party instead. So until you're celebrating, every new person that joins your team, you should not be celebrating when people leave. And that really stuck with me for a long time, and really reframed the way that I looked at orientation, and the way that, you know, I scheduled orientation and structured it.
Yeah, absolutely. So, and then of course, making sure we're teaching adults here. And so kind of knowing some strategies for adult learners and how they think, and then know how your employees learn and then use that strategy. So we'll talk about some characteristics of your adult learners. So again, a lot of us as adults are a little bit more autonomous and self-directed, right? We have experience, we are professionals, we should provide that professional respect for new people that are coming on board, right? We don't need to baby them and put them in a classroom and give them homework and all of those sorts of things. We have accumulated knowledge and experience based on our previous practice. Again, one of the things that we look at for new employees is somebody that maybe already has experience there. So, you know, you're not starting from ground zero. Adult learners have an accumulated knowledge base available to them already. Adult learners are goal-oriented, right? As much as people will say they're not people pleasers, they might not be a people pleaser, but everybody kind of has goals for themselves, right? It's why New Year's resolutions are a thing. So we have, we're goal-oriented, right? That gives us opportunities to then achieve those goals and gives us an opportunity to praise those new employees for achieving the goals that they've set for themselves. We're relevancy oriented. A lot of the questions that I've asked as an adult is, so what and who cares and why does this matter to me?
Matt's favorite.
It's my favorite 3 questions. So you can make a great point, but why does that matter to me and how is that relevant to the job duties that I'm going to be performing for the agency? And so if you can directly relate the policy or the procedure to what it is that they're going to be doing, specifically relate the thing that you're trying to train them to something that they are going to do. Their job responsibilities will make them more attentive and will make them more engaged in the orientation process. We have to be practical as well. Again, right, we talked about that 13.35 clinicians to 100,000 patients, right? 10,000 patients per person is not practical. So again, making sure that the tasks we're asking our employees to do are practical as well. And then that need for respect. And it should go without saying, but having respect for everybody in the agency, regardless of what their role is or is going to be, is crucial. If you're not showing respect for me, I'm certainly going to discount pretty much everything that you say to me. So I think that should go without saying, but it's an important thing to keep in mind, that you show respect to the experience that your employees come to your organization with.
I completely agree with that. And I think it's important to point out that many times you may have a hospice aide, maybe a senior clinician in your orientation group. And a lot of times, well, we know it's regulated that the RN supervises the hospice aide. That is mandated. It has to happen. But in that room, they should be equal. So no matter what you're doing, you have to tie it together in a nice way so that everyone feels validated, they feel respected, and they're able to contribute in a meaningful way, because that adds value and will definitely get their buy-in from day one.
Absolutely.
So the motivation for adult learners, everybody has a different reason that they want to learn. I'm lucky enough to have a 15-year-old boy at my house. He's not really motivated to learn. Thanks heavens he's smart. I'm not sure what his motivation is right now, but a lot of times it's social relationships. Maybe that's his motivation for learning. He gets to go hang out with his friends at school. Yeah. But I think we all, even at Axxess, we learn for different reasons, right? And the more we learn and diversify our knowledge, we get to hang out with different people at Axxess. So it becomes a very social reason for learning new things. So external expectations. So what do people expect from me? Am I good enough? Yep. The imposter syndrome lives and breathes, right? Yep. So that's what those external expectations are. What do people expect from me? What does my mom want me to do? Is she going to be proud? You know, that is a human, fundamental human need, is for people to be proud of you. Yep. It's really important. And so it's part of a motivation for adult learners. So why people go to college? Because mom said I had to. Yeah. Social welfare. People don't talk about that a lot as part of a motivation for learning. But if you think about it, everybody needs a job. Everybody has a job. Some of those are maybe non-paying jobs that are not less important than those that provide a paycheck, but social welfare, we got to take care of our family, right? We got to take care of ourselves. We need to make the world a better place. So the way to do that is to make money and spend money, right? We can grow the economy, we can give to charitable organizations. So social welfare is a big driver in motivation for adult learners. Personal advancement. I want to move up in the world. So I need to get a certification. How many people do we know that started out as an aide, that became an LVN or LPN, that are now RNs, that are working on becoming a nurse practitioner? You know, that is a very common thing in healthcare with nurses. So that personal advancement is important. Escape and stimulation. That's one of my favorites. So when I've had employees that are disengaged and I've talked to them and maybe they're having issues outside of the workplace that are causing them to be distracted and maybe weighing on them heavily, I talk to them about, let's make this an escape from that. While you're here, you don't have to worry about that. You know, you have a structure of things that needs to happen. You have people that care about you very much. So really that escape and stimulation. So, and a lot of people just are bored. Yeah. They need to learn more. Yeah. I need to know more. And cognitive interest. So everybody has something that they're interested in that would probably surprise their friends and family. But we are driven to learn more about the things that we're interested in. Absolutely. So learning style is an important thing to keep in mind, right? Not all of us are the same. It's why hospice provides person-driven care, right? Not everybody is the same. And so recognizing that not everybody's going to learn in the same way, as part of your orientation, you'll want to employ different learning styles and teaching styles for your employees to make sure that they're engaged. So trying to identify what type of learners you have in your orientation class. We have visual learners, we have auditory learners, and then we have kinesthetic learners. So your visual learners are going to do great with written instructions. Hand them a worksheet, send them off to to do what they need to do with their written instructions, and they're going to do great. Using diagrams, charts, and study materials, all of those things are going to be great. PowerPoints, visual learners love the PowerPoint presentation. So along with the PowerPoint presentation, then you also need to speak. So you have auditory learners as well. These people remember everything that you say, so be careful what you say. And they remember this through repetition, saying things out loud. They might be easily distracted by noise, but they could be equally as distracted by a silent workspace. And so, again, asking questions and getting engaged and kind of picking up on some of the cues that some of your orientees might be giving you. The last learner type is what we call a kinesthetic learner type, and that's going to be, those people that can't sit still. Fidget spinners sell in the millions here because people need to be doing something, to be physically involved in what they're doing in order to pick up and learn. Hands-on activities, and we often see that adult learners have some combination of this, and so employing different teaching strategies that allow them to read what it is that they need to be doing, such as a policy or a procedure, hearing about that and why that's important, but then let them practice. So again, hand hygiene is a great one for this. Take out your policy on hand hygiene. It's very clear. It's written down. You go over that in writing, and then take the employees into the bathroom and have them demonstrate successful hand washing technique. You're going to hit every learner type here. So nothing like hearing them sing the happy birthday song while they wash their hands. That's right. So choosing the right technology partner. Healthcare is very data-driven these days. Everything pretty much is, everybody has an EHR, so it's all about technology. So we've listed some things here to consider when you're choosing a technology partner or to have that conversation with your existing technology partner. Really, you want to have that ease of use. You want to streamline the operation. So your cloud-based platform, your mobile apps, the integration, those all streamline your operation. So, and most importantly, compliance. You want to be compliance driven and have the education within the software needed. So we have a thing that we talk about, having a nurse on your shoulder, right? Yeah. So that person that's whispering to the clinician while they're documenting, what they need to document, how it's appropriate, keep you compliant, and make them comfortable.
Absolutely. So mobile documentation, of course, is important, and one of the key strategies to preventing your staff from burning out is making sure that they don't have to take that work home with them. And so mobile documentation technology allows us to be able to do point of service documentation. And so really having an honest conversation with your staff about point of care documentation and how they can achieve that, have that discussion with your technology partner, but also have that honest conversation with your staff about the importance of completing that to driving increased patient outcomes, but also increased staff satisfaction so that they are not having to take their work home with them after they get done with work.
And for employee engagement, it is a two-way relationship, the employee and the employer. I want to say here that hospice is a business. There is an amount of finance that you have to discuss and consider every day. That does not include employee engagement. And if you are a leader on the phone, please, if you don't take anything else away from this, do not lead your conversations with your clinical team about money. Don't start there. Try to keep that separate from your engagement activities. So creating a highly engaged team, really your mission and vision. We've talked about that a lot on this call. It's really important. It's the only way to get this started. Empowering your people, giving them the opportunity to go out and do the right thing, to make a mistake, and figure it out and know that it's not the end of the world. So really promote that teamwork and collaboration. We're naturals at that because we do IDG so well. And provide that support and recognition. I can't overstate how important it is to catch people doing the right thing and to say thank you and to acknowledge that.
Yeah, absolutely. So again, aligning your efforts with your mission and vision, I think probably every one of us has worked at a company where they have a mission and vision statement and you hear about it in orientation, and that's the last time you ever hear about the mission and vision of your company. It's really should be at the center of what you're doing every single day. There's a reason why you decided as an organization that that was going to be your focus, and share that with your employees. We've talked about engagement and culture and hiring employees that align with your mission and your vision and your culture at your company. People that believe the same things that you believe are going to work harder, they're going to work longer, and they're going to work smarter for your organization. And so finding some of those likenesses in belief systems, tie that to your mission and vision, and really use that as the focus of your organization, and make sure that those things are there.
So when you define your culture, it's important to make that a group activity. So get the buy-in from your team, have them talk about what culture means to them. That is a completely transparent conversation. Anybody can say whatever they want. So have that under control. Think about your interdisciplinary work group. There is a culture there. Each team has a different personality. You can tell how that culture changes when people leave and exit the meeting. Really important to think about that. Your strategy includes not only who, but how you're going to do it. So think about that. Think about the personalities that you have on your team, your strengths and weaknesses of your team, and always include compliance and cultural sensitivity. When you are talking about culture, you always want to include cultural sensitivity. And so that can be age, that can be race, that can be a lot of things, right? People are at different stations in their life. So always consider that a culture, an organizational culture without cultural sensitivity is really kind of flat. So, and make sure you include everybody. Take the time. If they don't come to your meeting about culture, call them in and have a one-on-one meeting with them. Drag it out of them one way or the other.
I think that's so important. I love that, and the interdisciplinary work really defines hospice. And so many times you'll hear the psychosocial team does their thing, and the volunteer and the bereavement team is over here doing that, and the rest of the clinical team is over here, and the operations team is doing one thing. So I love having that interdisciplinary approach when you're talking about your culture as well.
Yeah, and I love empowering people. So here I really want to point out provide people with the necessary resources. You can't send somebody out to do something. You can say, this is what you're supposed to do. This is how you do it. And if you have a problem, call me and let me know. I'm here for you. I'm here and happy to help. You can communicate all that, but if they get where they're going and they don't have the necessary resources, you set them up for failure. So there's a difference in empowering people and setting them up for failure. So it's a very fine line, but it's easy to do if you think it through before you get started on that. And just remember, it's all about trust, and people are going to make mistakes. So you allow them to make mistakes, and you give them the opportunity to recover, and you support them in that recovery.
Absolutely. Promoting and encouraging teamwork and collaboration. I think there is some natural teamwork and collaboration that happens just by the way we practice in hospice care. But again, that communication and the transparency that you're able to provide for your team is really fundamental for getting their buy-in and keeping them engaged. Knowing what their expectation is a key to making sure that they meet those expectations. So clearly communicating that to them is going to be a great strategy for success. And then I think we're both pretty competitive people, so I love the individual and group accountability. So setting up, some sort of, team versus team, metrics or a KPI, who can have the fewest falls, or who can be compliant with, updating the patient plan of care every 15 days, really setting that up. It aligns with the, what's set up in your agency's policies and procedures, and it makes it kind of fun to be compliant with the rules that you've set in place.
It makes it easy. A lot of times we forget about the growth and development of our team. So we hire rock stars, everybody's awesome, we have the best team ever, but we forget to plan their growth and development. So that's super important. We talked about it a little earlier. People like to learn for different reasons. So planning their growth and development should start the first day of orientation. So that means let's have a meeting when orientation's over. We understand a little bit more about that person. We've spent some time with them. Let's have that conversation. Where are you going? What does it look like? How does it make you feel when? And really develop that timeline with them. Really important to provide the resources. So it's not about going online and watching a video and taking a test. This is about the person. So that's compliance. This is about the person. This is personal. Be flexible. People change. Things happen in their lives. Maybe they need to take a step back. Maybe something changes and it frees up more of their time, and all of a sudden they decide that they want to go back to college, or they want to go to college. Be supportive in that effort. Remember my 6% turnover because somebody decided to go to college? Man, I was hacked off because my turnover rate went up, but I could not be happier for her. And so delighted that she went to college and graduated. Don't forget, when you're doing your budgets in October, make sure that you include some funds for employee growth and development, right? So probably more important than the Christmas party or like the going away parties. Let's take that money and put it in a different pot. Let's put it in a different bucket and use that for employee growth and development. What can we do to help people be better and feel better about themselves?
Absolutely. So the last strategy we're going to talk about today is providing support and recognition. And I think this is something that we've kind of touched on throughout the process, but who doesn't want to be recognized? Who doesn't want to get their bronze star medal on their chest, from getting a pat on the back to say kudos and good job for doing what you need to do. And so really utilize every opportunity that you get to do that. And it's nice to do it in a private way, but it's even better if you do that publicly, so that there's some public recognition for your employees who are meeting the standards and going above and beyond the standards that you set for your organization. Part of support and recognition also goes to acknowledging when things don't go as expected. So that feedback loop has to be go in both directions. And so praising an employee for a job well done, but also giving some constructive feedback to an employee when something doesn't go as expected. use that as a teaching and as a learning opportunity for your staff to do better the next time, so that you can continually improve the processes at your agency. I think you'll gain a lot of respect from your staff from doing those things as well. So thank you very much for tuning in. Again, just as a reminder, we will have the slides available to you, as well as a recording of today's webinar in the Help Center on Axxess.com. Any of you that might have any questions, go ahead and we will reach out to you so that you can ask any questions that you may have based on the information that we shared, and we will get back an answer to you. So thank you very much for tuning in.
Thank you, Zaundra and Matt, for sharing your wisdom, expertise, and strategies to help us keep our staff engaged, productive, and passionate about providing the best hospice care. And thank you all for joining us today as we deliver on our mission to empower healthcare organizations and professionals with the world's best technology solutions. Thanks so much. Have a great afternoon.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading Help Center or at Axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.